Hey, welcome everybody in the audience and those folks watching online. This is our monthly or bi-monthly county commission. Central District Health Board meeting. Here we go already. Welcome and good to see everybody. At this time, I will call the meeting to order and have roll call. From Ada County, Dr. Ryan Cole. Dr. Cole, are you on? Okay, we'll move on down. Dr. Furch. Dr. Young. Boise County, Commissioner Tucker.
Here.
From trustee from Elmore County, Betty Ann Middleton.
Here.
And board member from Elmore County, Crystal Rogers.
Here.
And I am present. So we're all accounted for. We have a quorum. So we're going to move right on down the agenda. If everyone has had a chance to look at the agenda, if there's no additions or corrections, I would entertain a motion to approve the agenda as presented.
So moved.
Do I have a second?
Second.
Moved and seconded. All in favor, please say aye.
Aye.
Thank you. Okay, next on the agenda is a discussion and decision on Board of Health meetings. I think we have the 20th and then October 20th and November 28th.
That's it.
Is there, did everybody get a chance to look at those? There's no additions or changes. I entertain a motion to approve either one at a time or both at the same.
Approve both. Second.
We got a motion and a second to approve both minutes. All in favor, please say aye.
Aye.
Aye, motion carries. Yeah, I know we're moving along. We're probably a little bit ahead of schedule, but I'm going to keep right on going. Our next agenda item is the audit for fiscal year 21-22. Harris CPAs, are they in the room?
Yes, Commissioner Heswick, we have Cheryl from Harris CPAs here, and Conan is printing out the financial statements right now, so we'll have those
Okay.
to you.
You want to wait until we have those, Cheryl?
Yeah, switch us
Okay.
to the agenda.
So we'll pause for now until we get those. You need coffee or breakfast or bathroom, this would be a good time. It's really
I don't know. We go on to the next agenda item, I think, after this, or.
it's a financial report. I'm wondering what else we could do. Or do you have the financial report? don't you?
I do, yeah, and it's the next item in Dustin's presentation too, so it's fairly seamless to go to that if it's okay to make the agenda, or we can.
Okay, so we're gonna skip this agenda item, move on to the next agenda item until we get that stuff back for Cheryl. This is to review and discuss the FY 24 financial report. Laurel, I'll turn it over to you.
Thank you. Thank you, Dustin, for pulling up the report. So this report that you have in front of you is through the end of November, which is about 42% of the way through the fiscal year. I will start off by saying that we're still seeing the same thing we were so far through this fiscal year, and that is that we're struggling with the reporting functionality in Luma. So getting the numbers out of the system requires a lot of manual calculation, and there is still some miscategorization that's happening on the back end. Some of the things that are different in Luma compared to what system that we used before is that there's a lag in receiving payments and being able to code them into the system, a lag in being able to get payments to vendors, which of course creates issues with our financial reports. And then the reports that are canned reports in the system don't reflect the same level of detail. We're not able to pull data the same way that we were before. So Conan and his team are doing a lot of manual calculation to try to get projections and be able to see where we're at so far. The system functions on an accrual basis, and we do our accounting on a cash basis. So with those differences, the system shows credits and debits, not actual funds that we've received and spent. So there's a lot of, again, just that manual calculation that's needing to happen to be able to prepare this report that you see in front of you. It's not just us who's struggling with it, it's the whole state. Probably seen newspaper articles about it. Just a reminder that we are still seeing that. You'll see some of those numbers in this report. We're working as well as we can to, one, learn the system fully. We're still, 5 months into it, which is still very new. It's going to continue to require a learning curve. And then the state's looking at some mitigating solutions too. I know they've looked at some additional software for some contract and grant management. So they're looking at pieces and parts that they can put together for reporting and the financial management out of the system too. So
Laurel, quick question. Before I ask that, Dr. Cole, I see you've come on. Welcome, sir. Can you hear us?
I can hear you. Yeah, I'll get video here in just a second. Thank you.
Thank you. Well, welcome. Laurel,
Thank-
how long is the delay? Are we getting people sending us interest charges now because we're not paying?
we have had a couple of not interest charges, but or late charges, but we have had vendors that have been paid late. Yes. So we've gotten late notices on some things. And again, that's not just us. When we get those, we're trying to expedite them and get them through the system. There've probably been 3 or 4 times so far that we've had an entire batch of our P-card transactions that have been denied after we've entered them into the system as fully as we think they've needed to be. One of those was a mistake at the SCO level that denied all the transactions that had happened in one day. So throughout the state, everybody had to go back through and enter those. And then we've had some days where we just are notified that per card, all of the transactions on those get denied. So sometimes that happens really quick in time after the transactions have happened. And sometimes we don't get notified till a week, 2 weeks after they've happened. So all of that it creates a lag in being able to pull the data out. We're optimistic that it will work, that we'll continue to be able to work with it, learn it. Errors on the SCO side will be resolved, and that we'll be able to do the same thing. We're optimistic, but also would like to see a little bit more functionality in terms of reporting and the way we're able to pull data. So we're not, there have been some frustrations, but we're not feeling like we need to go with a different system or anything like that. Yeah.
Well, Laurel, is it safe to say that these are all within 30 days, these figures?
I'd say so, yeah. And we're confident in the total number of expenditures and revenue, the percentages that you're seeing on page 1. It's more just the subcategories and how things have been coded rolling up into those numbers. So when we prepare the report for you, we're confident that our totals are correct, that there's just probably going to need to be some continued correction on the coding that happens on the back end. And for some things like fee revenue, things like that, we expect that we'll see some shifts closer to our planned amounts as the year goes on, and where we're at with the numbers.
Go ahead.
I know vaguely that there's a difference between accrual accounting and cash accounting. If the software is designed on a accrual basis and this is cash, is there going to be a conversion one way or another so that they mesh, or is these things going to come?
That's something that the financial officers have talked about among the health districts, having a lot of conversations about Luma. Do we learn to pull the numbers the way they're represented in the system and make them work for us with the way that we're counting now? Would it make sense to shift the way that we're performing our accounting? But there haven't been any decisions made on that. And I don't know if the state's talking about anything like that. I'm not sure.
I'm sorry.
Are we required to go with them? Are the health districts required?
We are not required to. The ease of staying with Luma has mostly to do probably with payroll benefit system, that functionality in terms of our accounting software. If we wanted to consider another system, that would be an option for us.
Mr. Chair.
Yeah, go ahead.
Commissioner Rogers said Public Health District 3 actually is looking at alternatives, so we thought we would continue down this path and see what they learn. Their director, Nikki Zog, has shared that with the district directors, and I'm not sure what the timeline is on it, but that's something I can share back with the board as they finish up their assessment, decide how to proceed. But there'd be a lot to it. Making that shift after we've already made the shift, I mean, it's like electronic health records. As you guys know, that it's never as easy as on the sales side of a product. So
Well, it's kind of interesting because I know in our county, we're switching over to a whole new software program. It's called Tyler Technologies out of Texas. But we still have to use the old system, which is called Computer Arts. So we're paying for both right now, which is really kind of tough. But we need one in order to mess in the other. But I'm kind of get the feeling that some of the stuff Bloom is going to do, we'll have them do, but some of the other stuff we can probably do. And certainly keep that option open. My question more is to Sylvia, Cheryl, will this affect an audit?
I mean, the audits that you currently have are on the cash basis. I mean, if you switch to accrual or some other software, always switching software affects the audit and the way documents are produced.
This is probably going to be a big issue statewide with audits. Okay, continue on.
Okay. So getting to the report itself, looking at page 1, you can see our revenues are coming in a total of 42%. So right where we plan to be at this point in the fiscal year. There's a few fees that stand out where we had planned 0, and you can see in administration, there's a $500 fee that showed up there. That was for an honorarium. We don't usually have fees that are received in administration, so I hadn't planned for that. And then in support services, we paid a fee there for an education enrollment. So neither of those were planned, but they are showing up there. Those are correct. And then community environmental health and family and clinic services. You can see in CEH, we're right about where we plan to be, 47% of planned amounts for this far in the fiscal year. And family and clinic services, we'll talk a little bit more about that on page 2. We are a little bit behind our expected fee revenue. Contracts are coming out a little bit ahead in community environmental health and a little bit behind in family and clinic services. That brings us up to an average of 43% for this far in the fiscal year. And then our other fees, that's where we know some of the miscategorization is happening, and that you look at support services and the other column, our actual received amount is $35,000. We're only planning $18,000 for the entire fiscal year. That is the other category for revenue is a little bit of a catch-all for any transactions that were miscoded. So that's why that one is inflated to that level. Those should more than likely be in either FCS or community environmental health, and we'll correct those as we get the data in for that. No interest revenue showing up. Conan's looking into that. So far, we don't know if that's one of the lag items that just hasn't come into the system yet. We are expecting to see interest revenue by the next time we have a board meeting. Moving on to our expenditures, as we've seen the last couple of years, our personnel charges are slightly under where we expected to be at this point in the fiscal year. And typically by now we are a few percentage points under where we plan to be for personnel costs. And that, as always, has to do with pension, attrition, anything like that, where we just tend to be a little under where we plan to be. And operating is showing us over in both support services and administration. For expenditures, operating is where we have the catch-all. So we're showing over for expenditures and under and over for other in revenues. And that's where we have the catch-alls in kind of both categories where we know there's some miscoding happening on the back end. Overall for expenditures, we're rolling up to about 39% of where we plan to be at this point in the fiscal year, 42% of the way along. So pretty close to planned amounts. Moving on to page 2. Page 2 is our look comparatively over the last couple of years, where we are at this point in the fiscal year. Our fees are showing under where we were at this point in the fiscal year compared to both last year and the year before that. Pretty close to where we plan to be for most of the fees in community environmental health. In family and clinic services, our fees are coming in at about 182,000 so far this year. What I'd like to point out there is that our clinic has been busier than ever, and the fees that we're charging each month are about twice as much as what we're receiving in revenue. So although it looks like our fee revenue has gone down, it has gone down, but we're busier than ever. We expect some of those charges to start coming in, and we're charging more than what you're seeing in terms of what we've received in fee revenue. So there's a lag there.
Is that another Lima issue?
I don't know if that's a Luma issue or an issue with people being able to pay the bills of receiving, if it's lag in receiving insurance payments. Not sure where the gap is there, but we did go back and look this week at what we're charging compared to what we're receiving, and it's about a 50% gap. So pretty significant, but we do expect to see a shift there. Okay, looking at contracts, we continue to be increasing our contract revenue year over year. That's been a trend that we've seen that's continuing to get in grant funds and any other contracts that are allowing us to do all the good work that we do in our communities. And then looking again at our expenditures from different perspective, you can see that we're under in both personnel and capital costs and over in operating costs and trustee and benefits. And as just a reminder on our trustee and benefit costs, they don't always come out equally divided throughout the year. So it depends on when we're paying out those trustee and benefit costs. Right, so moving on to our cash balance statement, which is the final page. First thing I may be drawn to, as mine was, is that we have a negative balance of our undesignated and unrestricted cash balance at the bottom of the page there. It's a negative 423,000 at the bottom. Some of that is due to a lag in being able to receive funds into the system and transfer funds between our operating and LGIP operating. So I'd like to explain that a little bit further. Our total cash balance at the month end is still 9.6 million. So that's where we're at. And then all of our special projects and the amount that we have designated to all of our reserve funds hasn't been spent yet. So it's still there, but the balance does come out to a negative 423,000. We still have our cash on hand. And again, we still have all of this that's unspent. It's just designated to be in projects or reserve funds. So don't actually have a negative cash balance, but all of our reserve funds and special projects were to be spent, it would come out as a negative. So point that out. And then once we get in the next round of county funds and the transfers happen, that there was a lag in, we do not expect that to be something that you'll see at the next board meeting. So I wanted to explain that a little further. And then I have updates on all of our special projects. I'd like to provide that as well. First of all, employee retention special project, we'll talk about that. By the time we have the February board meeting, that fund should be down to whatever is left over after we've paid out our employee retention incentive, which happens the first pay period in January. So we should see a very small balance in that by the February meeting. For our environmental health system upgrade, we've had a couple more meetings about that over the last couple of weeks, and we're ready to move forward with getting a contractor or vendor in to do the upgrades that are necessary for our environmental health system. We anticipate starting that pretty early in the next year. And the issues with the system are that it has an old browser, so all the pages that they're doing inspections on basically need to be upgraded to the new browser. The system we have functions. It's just an older system and needs some upgrades. So we'll be hiring a vendor or contractor to do that. Part of the reason it's taken so long is that we looked at whether or not it made sense to buy an off-the-shelf system, do a transition to something completely new, or work with the system that we have and that we built in-house. And after that analysis, we've determined that working with what we have, making the upgrades is going to be more than functional for what we need it to do. And it will integrate well with our Office 365, with our transition of our IT products to the cloud, using the system that we built works well with those things. So that's our plan. And we should start seeing those funds be spent down as soon as we get the vendor contractor hired and working with us, starting on those upgrades. The big update, the one I'm most excited about, is the van purchase update. So we talked a little bit about that in the last meeting. We have gotten 3 quotes in on the type of van we'd like. We're looking at Sprinter style van. They look amazing. They all have hand washing stations, water tanks, a chair to be able to do blood draws, all the things that we need for the van to be functional for our programs. The issue is, as you guys all predicted, they're more than $100,000. So the quotes came in at about double that, in the range of $200,000 to $230,000 for all of them. That does include some things like wrap on the outside, the awning, some of the features that look really nice. The awning, we think, will help with functionality too, just protecting people in and out of weather. Some things like the wrap, once we move closer to deciding what we want to go with, we'll consider whether or not we need some of those additional features, or can save money and add those things on later. So it's not an action item right now, but during the budget revision, meeting in February, we'd like to add the van as an action item and potentially look at asking the board to designate more funds for the purchase of a van. So this meeting, just kind of letting you know what we found so far, planting the seed of where we'll be going with it. And then we'd like to wait until after the February meeting, looking at what our budget is and what we may be able to designate before we sign any contracts and move forward with the purchase of a van.
Laurel, go ahead, Dan.
Now, Laurel, is that van ready to see patients, deliver
Yes.
care? That's got everything.
It's not primary care, sorry. We would use it, our epi team would use it, and our clinic team would use it for immunizations. So it's not a primary care van. I did want to clarify that as well.
Okay, and do we have any, will we, at the February meeting, have any estimates on what it will take to upgrade that to primary care also?
Yeah, I think we could use it for primary care. That's just not the intent immediately, where we don't have providers that could provide, but it would have everything needed once we do want to do primary care. So,
Okay, thank you. And Laurel, another question is, and this comes up regularly, for the increasing costs and our patient load, is our operational 3-month reserve fund still adequate?
The answer to that question is yes. We have increased that over the past couple of fiscal years in accordance with what our budget is. It was our operational reserve fund when I started was right about 3 million. So we've added 1.3 million to it, another 50% just to account for a larger budget and make sure that we do have enough for that 3-month reserve. So the answer to that is yes.
Laurel, I guess my question in the counties, if anything over 50,000, we have to have bids. And then we go through and award the bids. Central District Health, I'm assuming, is the same way.
Yeah, so we've received the bids. I referred to them as quotes, but we have 3 complete bids or quotes on what the cost would be, what all the features are that are included in those, everything. We can do a presentation at the February meeting so you can see what we looked at, what we considered, and make a determination on which direction to go.
Because I think visuals would be good too. If you could bring those February, that'd be awesome. So we can kind of see what we're looking at.
Yeah, I didn't understand the level of features that they have and what they really look like inside before looking at the visuals. So I agree. I think the visuals will be helpful to see what product they're providing to us. That's really cool.
Okay, any more questions for Laurel? All right, good job. So Cheryl, did we get what we needed yet?
I believe we did.
So I'm gonna request a 5-minute break while he's handing those out. I'll be right back.
I don't think none are local, they're all out of state.
Oh.
Thank you.
Is there like a website we can look at one of them?
Yeah, we will at the next meeting, yeah.
Or if I can wait that one.
Do you want that to play? Oh, no, he's not. Oh, he's not.
Let's be, please.
Okay, before we get into this, Cheryl, I hope you don't mind. I forgot, and I would like to have the folks on the side introduce yourselves. So we could all kind of know who we're.
Leon Sylvester, member of the public.
Maria Ortega, Communications here at CDH.
Stephanie Myers, Division Administrator of Clinic Services here at CDH.
Curtis Lovelace, Division Administrator for Community Environmental Health.
Logan Chu, Financial Support Manager, Central District Health.
Good morning, everyone. I'm Alexis Pickering. I'm with the West Gentle Community Health Fund.
Thank you, and I apologize for not doing that in the beginning. So at this time, we're going to go back and review our audit for 2021, 2022. So Cheryl, I'll turn it over to you.
Great, thank you for having me here. We wanted to just briefly just present the audit that we just finalized for everyone. And so the main thing to note is that the opinion is unmodified, and so no findings or no qualifications in your opinion. It was a cash basis audit, so 2021 and 2022 audits that are now being issued. Good cash position. I'm sure that you talk about this at every meeting. So, cash increased into 21 and then into 22, $1 million over those 2 years. Funding increased in this period, right? 2021, there was a lot of COVID funds, and then so revenue was up 21 over 22 by about 2 million. But overall had a 3.3 million change in excess cash over or excess revenue over expenses, and then a $1 million dollar increase in 22. So over the combined periods, $4 million increase in cash. So between 2020 and 2020, the end of 2022, significant increase in your cash balances. As you know, the majority of your funds come from state, county, federal grants, and then also these charged from services. The notes to the financial statements just explain the balances in the financial statements, since you're on the cash basis. They're very straight, they're straightforward. They do talk about those, the amount of restricted funds, unrestricted, and then designated and assigned funds that the district holds. Back in the back of the financial statements is the single audit, and so whenever entities have federal funds, there's a requirement that we do some extra procedures, and in accordance with the federal guidance, we audit. We determine some major programs to audit, and we audit the programs. Back in the back, you can see the 7 programs that we 7. Programs that we determined were major programs and audited, and the report part on that is no findings on internal controls or material weakness or significant deficiency in internal controls or compliance. So a clean report in your federal portion of the audit, the grant audit as well. All I have, unless you guys have questions, and you know exactly how much detail you wanted us to go into.
Well, feel free to ask questions. Sorry, guys, I'm trying to read too.
So being the new one here, how did we come to end up doing 2 years in one audit?
Sure.
And how often are we required to audit and some of those logistics?
My understanding is that you always do the audits every other year for a 2-year period. So that's historically the way it goes.
I think that's by code, isn't it? State code?
I don't
Not
think
one that I'm
it's-
familiar with.
It's not in code. We have considered before going to every year. Some federal grants prefer an annual audit as opposed to every 2 years. Cost wise, it saves money to do it every 2 years instead of every year. And we haven't not been able to get any grant funds because we do every 2 years. So it hasn't been an imperative to move to a more frequent schedule. But it is something we've talked about as an agency as a possibility.
Code that we have to do.
I think it's
I mean, that's
at least
internal.
every 2 years.
The counties have to do it every year. Our districts, EMS districts have to do it every year.
I think you can do it every year, but you don't have to, but you must do it every 2 years. I think is what we're saying.
Okay, any more questions for Cheryl? So I'm assuming this is an action item, so we would need a motion to accept the audit as presented. It's not an action item. It's not an action item. It should be. You're supposed to accept it. You want to do that in February?
Yeah.
I think you need to put this on as an action item to accept the audit. Otherwise, it's just kind of in limbo.
Thank you.
Thank you.
Thank you, Cheryl. Okay, we're gonna move on down. How are we doing? We're not too far ahead, are we? Our next agenda item is the WICSI budget review and implementation plan progress. Alexis, welcome. Come on up. That's an end.
I would ask this.
There you go.
Good morning, everyone. Good morning.
Morning.
It's been a little bit since I've seen your faces, so I'm happy to be here. And I obviously don't know some of the newer folks, so it's nice to formally meet you. Commissioner Tucker, are you happen to be related to Coach Tucker and Lainey Tucker?
My mom's sister.
So she was my coach at Walla Community College.
Oh.
That's wild. I figured there was a relation there. So Yeah, we're happy. All right, so I wanted to give you a WICHC budget review and implementation plan progress update. I heard at the last presentation, you guys had some really good questions about how does the funding work? What's the structure behind all of this? And hope that I can answer a lot of those questions today. And feel free to ask along the way. I don't like to just kind of wait until the end if that's okay with you.
You bet.
Okay. All right, that's the next slide, please. All right, so yep, that's what I'm going to be talking about today. Next slide. All right, so just again, as a little background reminder, WICHC is a multi-sector public-private partnership. It was established in 2019. I'm going to talk a little bit about how it was established because funding is involved with that, of course. It is an unprecedented partnership in Idaho. We've got 23 members representing 17 different organizations, and we're typically public health, healthcare, social services, or community-based organizations, all aligning together to address the social influencers or determinants of health. And the reason why we're all working together on those issues is we know that those are the root causes of what creates good health or poor health. It creates the conditions for folks to thrive. We've got, more likely to address high healthcare costs, Medicaid costs, right? So if we go far enough upstream, we know that we can generate those savings. That was really the main impetus behind convening all of these partners to work together. Because oftentimes, although we have really great intentions and we're all doing really good work, it's easy to stay in our silos and duplicate or leave really massive gaps simply because we don't have the capacity to collaborate. And so because of the vision and leadership from the health districts, namely Southwest and Central, as well as for private funders, they said we needed a FTE and an actual collaboration that brings all these partners together. Because as you guys know, it's really hard to maintain and build momentum on new projects on top of your already strapped day-to-day jobs, right? So we needed something that could convene these partners as a separate entity that was a neutral convener. And so that's really the beauty of the collaborative. And we recently, actually like a year ago, we published our first evaluation, and it showed that we're generating that value, that folks in the community really see the tremendous impact of having that neutral convener in this framework is really effective. So it's working really well. Next slide. So these are the WICHC funders. They make up the funding council, which I'm going to talk about a little bit more. But as you can see, there are a lot of probably really familiar names that you know of and see there. But we've grown quite a bit since we first started. Next slide. So we basically use a braided and blending funding structure. So I'll get into that a little bit, but from when we started in 2019, we had 4 private funders, and that included Pacific Source, Blue Cross of Idaho Foundation for Health, St. Luke's, and St. Alphonsus. And they all said, we're going to pledge $10,000 each. Will the legislature match us in this effort to start this collaboration up? And for those of you that might remember, there was that massive SHIP grant, that statewide healthcare innovation plan grant. It was millions of dollars that was awarded to the state to move our healthcare system away from fee-for-service and moving into that quality, value-based care model. And so a lot of the legislature and our partners were saying, if we're going to make this big move and how we're funded and, reinvested in terms of, our healthcare and our metrics that we're looking at, we also need to be investing in the community so that the savings can actually be generated, right? Because we know that health isn't created within the 4 walls, right? So we needed to start and create something that supported all of these other efforts. So we got unprecedented funding from JPAC to start this collaborative, and namely nearly $120,000 in 2019. And then we came back to them in 2020 asking for a 20% decrease. It was unanimous and we got that through, which was really exciting. And since then we haven't had to go back because we've been sustained with private and public dollars. Any questions about that?
Two questions. How much does Central District Health put in? And second question is, have you contacted Cascade Medical Center? Do they put anything into this?
So to answer your second one, no, Cascade does not contribute anything to the collaborative. But if you have a connection there,
Yeah,
you
you
can pursue that.
I'll give you a name.
Okay. And so each funder that was on that previous slide, everyone contributes $10,000. So we had original 4 funders, and I've increased it to 9 over the past 3 years, so more than doubled it. So that means we get about annually like 90,000 from all of the funders combined. I do pursue grants to support those projects. And of course, if there's any particular project that might resonate with the funder, they may allocate additional funds to support that project. So I want to think of it as this way, that we've got infrastructure dollars that they pay for the collaborative to exist. That's at $10,000 each. And then funders or that are on this collaborative or other ones that are not part of it, they can layer or braid additional funding for projects that they think really align with their mission. So there's 2 different types of funding, which kind of can confuse folks, but there's infrastructure and then project-based funding. So, so that's where that like layering additional funds where they have that interest. Any questions about that? Okay, next slide. So this is kind of the structure, because I talk about a lot of different moving parts here, so I felt like this would be worthwhile to share. So we've got the funding committee or funding council is what I call it. We also have an executive committee. They really just set the stage for how the collaborative should go over the next year or 2 years. Russ is a member of that. Nikki is a member of the funding council representing both health districts, and I worked with Russ and Nikki to kind of see how we could work through that membership because it was during COVID. You guys were super strapped. So we kind of consolidated their leadership on each committee there, representing the health districts. And then we have the WICHC members. And then with this implementation plan, as you guys saw, we've got 3 main categories that are in alignment with the CHNA priorities. So we're going to be building 3 specific work groups and sprint teams or task forces that are going to be working on specific projects that are looped back in that plan. So that's the structure. The funding council meets quarterly. CDH is the fiduciary and fiscal agent for WICHC. So we invoice those funders. We interagency bill the health district, Southwest District Health, and that's how we physically get the funds.
Question.
Yeah.
How many are on the actual WIPSI?
23.
23. Thank you.
Yep. Next slide, please. All right, so I wanted to kind of go year by year and all the funding we've received. So in 2021, we received our first large grant award. We were the first recipient for the Get Healthy Idaho Award. So for those of you that aren't familiar, the state, the Department of Health and Welfare, usually when they provide grants, it's, we understand this health need because of data. It's, this community has high rates of diabetes. So we got some federal funds to do some diabetes prevention programming or yada, yada. And they say, health district, go and do this thing in this community. And that's kind of really the old model. And, oftentimes, and I think, Crystal and Betty Ann, you guys know this really well. We've had lots of talks about this, but the community, they're like, that might not be actually what they think is the top priority, right? It's behavioral health. It's this other thing. And so that can create a big rift between, public health and the health district and the communities that we're entrusted to protect and serve and work with, right? That's a mismatch of values and priorities. And so luckily the state kind of caught on to that after us telling them, year after year, like we need something different here so that we can actually work on projects that the community wants us to work with them on. And so they were able to kind of look at a different model from Rhode Island, actually. It's called the Health Equity Zones, if anyone's interested in looking at it. But basically, they blend and braid various federal funds and Then they say, okay, we'll give this to the community and you guys can decide how you want to go about doing these activities. And so with that, we got $155,000. It's a place-based grant. So we've had this grant for the last 3.5 years. I'll talk a little bit more about how I got that increase. But basically, we did our first ever qualitative health assessment in Elmore County, and the first of our kind in health district history, where we said, we've got all of the clinic data at the yin yang. We don't need to know more about that. We need to know more about what is causing these health issues. What's the why behind it? What's the story? And so I've got that report if anyone's interested. But basically out of that, they were like, we want to explore CHEMS, Community Health Paramedic Program. We want to increase access to physical activity in open space and trails. We want to do more in the active transportation space. And we want to foster more community and clinical interventions and connections through standing up a more robust CHW program with our existing partners. So 4 really heavy, big lifts. And so with that, I went back to the state and said, we really don't have 3 things, we have 4. Is there a way that we can advocate for additional funding? And so they were able to bring the Bureau of Emergency Management, and they contributed an additional $80,000 per year to support that CHEMS work. So this is unprecedented even for the state, and they've gotten 2 other communities online with this grant award, and they aren't even as close to the 235 that I was able to bring in. So I think they're around like 100K or 115 or 80,000 so per year. So that's really exciting. So we also received $10,000 for the Federal Reserve Bank of San Francisco. I applied for funding from the COVID equity funding that they received, and that's what paid for our WICHC evaluation and what helped create that Idaho Board of Community Health Atlas that you guys hopefully you remember and saw. But that was from 2021 and 2022. And of course, some of those grant funds support staff time. So that's kind of where we're packing on some of those funds to support that work. But any questions? Yeah.
What is the interest of a Federal Reserve Bank in this effort? What is the nexus?
Absolutely. Yeah. So we've got a great regional representative. Her name's Leilani Barnett. And basically the Federal Reserve is deeply interested in stabilizing the health of the community, because that has an impact on the economic vitality of a region. And, if people can't afford, or if they're not well enough to work, right, that's a big problem. If they can't afford to have housing, all of these issues have an economic impact, right? And so they're really interested in how can we support existing efforts to better understand the needs of those communities, or what their role is in addressing these complicated challenges, or maybe even the economic component to how this impacts a community in real time. So they're a really great partner, and they're actually helping us with our January 11th event that I sent you guys all an invite to earlier this week. So does that help?
Yeah.
I just have another question too. Could you mentioned pretty quick about the paramedic level. Where are we on that? Because that's been really huge in our county. We're trying to get all of our EMTs to paramedics. Boy, is that a spendy cost. But in the long run, it saves a lot of transporting people to the hospital. They can balance them and get them straight at home and not have to bring them in.
We have, it's astounding how much work went into that and the results. She's busy. Our Kim's, she actually presented last week, and it has made a huge difference on the people who continuously call. And she reaches out to them, and she's actually fostered a really good relationship within the clinics to get those folks that need it help. And I don't, she's probably just barely skimming the surface.
Oh, totally. Oh, yeah.
Well, is there any funds available to take EMTs and get them certified as a paramedic? Because that's our biggest thing. And I think they have to go somewhere for 7 months every year to do an in-service, in-clinic thing. And
There's Hennepin College, which offers an online version where they just do clinical hours
cool.
here, wherever they are. So I could talk offline with you out if that works and kind of explain some of those
Well,
options.
there's the other thing that the state has now with the, what's it called, Insight? What is it called, where they offer scholarships up to like $4,000 or $5,000 for someone to go get a certificate in whatever, welding or truck driving.
Launch.
The launch program.
Thank you very much. Is that money available for some of this stuff as well? Do you know?
I think the launch program is targeted to graduates of 24 graduating high school class. I hope the legislature will.
Yeah, there's two branches of Idaho Launch. The Workforce Development Council and Idaho Department of Labor are the ones who give those funds out. So the initial branch that they did with Idaho Launch was that workforce training. And that's been going for about 3 years now. I think I did the first training on it before I left Department of Labor. And then the 8,000 per high school graduate for graduates of 2024 is a new, they weren't spending down the funds, I think, as fast as they expected to with the workforce-based training. So both of those do still exist. And it's the most in-demand careers based on your geographic location that you can get funding for. There's a series of steps you have to go through. I think you talk initially to the Workforce Development Council, then they'll route you through a consultant at the Department of Labor to get you connected to those funds. So both arms are still going, and the graduate, they're hoping, really takes off.
Hopefully the legislature will expand the eligibility on that. I think it's really big need.
Oh, man, it's huge. I know in our case up there, I think we've had 6 or 7 guys in our road department get CDLs using that fund. And then they get a pay, a bump, and when they get the CDL, it just works out great, and we're trying to find out a way to do it with paramedics.
Well, if you don't mind, I wanted to kind of build on that. So this was a kind of a, I don't know if I want to say like leap of faith, but basically the Bureau, has given another grant to, was it Lincoln County or Bannock County EMS to try out a CHEMS pilot program. And basically, it had some success, but they really weren't pleased with some of the lack of outcomes and like kind of those connections, like you mentioned, Crystal, like the relationship with the clinics and those types of things. And so when we had received the Get Healthy Idaho grant, we explained kind of the WICHC framework, right? We've got this regional collaborative, we've got clinical public health providers. We also have connections within the community that we're partnering with. The Bureau was like, I think that's the missing link with a lot of these, EMS providers. They're so in their wheelhouse and like trying to, put out fires on a constant basis. They don't have this other, infrastructure to support this broader vision of like holistic health, despite their best efforts, right? And so luckily the Bureau kind of took note of that and thought, well, what if we invested in this, having the public health district facilitate this pilot and what might be different because of it? And I think that's really what we're seeing is, what might have happened if you directly just give it to us versus just with a little help and assistance from public health district staff to make those connections and grease the skids so that it can go a lot further faster. So we also got really lucky because we got a unicorn with Jennifer. So
Yeah, she is amazing. And has she, this is, kind of specific, but has she kind of given you guys feedback on the other issues, like folks not having heat, the cleanliness of their, that stuff? So I don't know if, that can be incorporated in it, but they're struggling.
Yeah.
Folks she sees are really struggling. More so than me.
Right.
Anticipated.
You know what, I'm afraid what it's going to come down to is paramedics and even small clinics are going to be more of a social services. Like if someone doesn't have power, can't afford, they can hook them up with LIHEAP or other agencies and get the LIHE program, get all that stuff paid for and signed up. Instead of just hauling somebody to the hospital, it's going to be a lot more.
Identify other needs.
Mm-hmm.
Oh, and Jennifer's able, Dr. Rose is able to do that, right? Because if she doesn't already have those connections, she can reach out to me or Courtney, and we might know who that is, right? And so, or at least even if there isn't a partner or community-based organization that can fulfill that need, then we can catalog that as, well, who can hopefully address that need? Yeah.
We're kind of doing a similar thing up in our area with mental health, and basically a directory of different providers that can do counseling services, whether it's juvenile or adult or substance abuse or whatever, and setting all that up into one system. And then eventually we'll have a link on our webpage, the county webpage, that you can get to that person and get to that contact, and hopefully, you know, maybe save somebody's life. Who knows?
And what's great is, Dr. Rhodes in the CHEMS program is on Find Help. So that's a really great referral mechanism for
Find help.
findhelpidaho.org.
No.
We should, and we got a lot to talk about with that one. So yeah, we should talk more. But I don't want to keep you guys. Any other questions about this slide before we go into 2023? Okay, next slide, please, Dustin. All right, so this year, we again got another installment of the Get Healthy Idaho grant. Just a little thing, it ends in fiscal year 2024, well, technically September. I was awarded a NACHO, so that's the National Association of County and City Health
Officials.
Thank you, officials. Thank you. Like, blah, it's been a long week. And basically, I mean, you guys know this. It's a best practice. I'm going to say it's a requirement, right, that we evaluate our work, right? But oftentimes, due to all sorts of things, right, it kind of gets pushed on the back burner. And so we were able to get the WICHC evaluation, which is the first of its kind, measuring kind of the framework, evaluating the framework of this collaborative and the effectiveness, the strengths, the opportunities for improvement. But I was also able to layer additional funding for evaluating the Get Healthy Idaho grant itself. And so we received $85,000, and it's in 2 installments. So that's why it's going to be closing out in March in 2024. But basically it's paying for our staff time to provide data to evaluators, and they are providing the evaluators. So I'm not having to contract out and find someone. They're bringing in national evaluators from RTI International, which is an incredible firm. And they are doing a cost benefit analysis. They're doing all of these incredible, analyses in like several different sections. And they're looking at how did the Get Healthy Idaho grant deliver on some of these metrics. And so what's great is then we're going to give that obviously to the state and be like, this is why hopefully you should continue funding types of grants like this that work with the community, that also fund collaboratives or coalitions that build capacity within these communities. And then also, of course, like the effectiveness of WICHC being a facilitator of that change. So really excited about that grant. And then we were able to blend $30,000, 5 of which came from Central, 5 from Southwest, 15 from Luke's, and 5 from Salts or Intermountain, to pay for an implementation plan facilitation. So you guys saw the plan. It's really beautiful. It took a lot of work, but I knew that I couldn't facilitate that process while also maintaining everything else that I'm doing. And so it was really essential that we had some assistance and guidance and staff time to facilitate that. And we completed 19 interviews, 2 workshops, a whole lot of stuff. So with the help from them, they were able to make that happen. So we've got, final installment of the Get Healthy Idaho grant. We've got that funding closing out from NACHO, and the plan is to continue to, of course, apply for funds, but it'll be all linked to the implementation plan. So we've got several in the queue for January that we'll be applying for, hopefully, and then a lot more as 2024 rolls around. So those are like the additional funding pieces. So any questions about that?
Alexa, real quick, is the Agnew Beck, is that a local firm, or you said that was?
They have a local office here, but they exist also in Alaska and Utah. They do a lot of really great work.
Yeah, I think I've read about them.
Okay, next slide. So I want to kind of touch on some other funding opportunities. So this work is, super, obviously I love to say like it's really nerdy, it's technical, but it's exciting, and people need this expertise. They want access to our collaborative members. They want to know how this works. And basically we partnered with LEAP. They just broke ground on a housing development at Mountain Home. It's an affordable housing development. And, a lot of these partners are like, hey, we have this idea that this is what actually the community needs. And we were able to use our data that we collected from the Get Healthy Idaho grant and other things to say, actually, this is what the community needs, not what you thought it was, based off of data. Here is, we gave them an entire really well thought out report about, all the way down to colors that they should consider based off of the cultural responsiveness of the community, all the way down to like, this is how you should structure, the engagement of the neighbors within that development. How do you build that resilience in there so that they can, either get healthy or get a better job so they can move out and then more people can use those services that need them. So anyway, we also gave them some great examples of how to partner with the Idaho Food Bank, offering the first ever 24/7 food bank on site, because we've never done that in Idaho. So that was a perfect example of how the food bank was like, hey, we've really wanted to try this model out. This feels like a perfect fit within this development. So again, I facilitated a task force of WICHC members and folks from Mountain Home to inform that report, which they paid us or paid me for that time to facilitate that conversation and this report. So that's an example of how we can also receive funds. We also partner on other grant opportunities, and unfortunately, we just found out yesterday that we didn't get this one, but the Oregon Public Health Institute reached out and they were going to be applying for a multi-state grant through EPA. And basically EPA has, millions and millions of dollars that they're trying to get local communities to apply for, but they don't understand oftentimes how to get those communities to apply for those grants. Idaho, of course, is one of the few states that doesn't apply for a lot of those grants, and we leave a lot of money on the table. So we were going to be a partner to help get communities to apply for more of those grants. We could bring those dollars back home. So unfortunately, we didn't get that grant. But there's going to be a lot more like it. So that's an example of how we are partnering also with other states to support this work. And then, of course, I bring other funders. So, for instance, the CHNA, Regents Blue Shield, also participated and funded a portion of the CHNA. So I'm able to blend additional funding outside of just who's at the table, which is exciting, in addition to a couple other funders. Questions?
On the EPA funding, is there a homepage that we could go and look at what those grants are?
Absolutely. I need that too.
If you could. We have 2 grant writers now, and I'm telling you what, they're awesome. They're finding money everywhere. A lot of different functions, especially in mental health. So I'd be interested to see that. We could turn them onto that. They could go look.
No problem.
Great.
I think it was something around, I think ballpark, the funding that this grant was hoping to push through to the communities was like, I think 70 something million. They were trying to get that out to Idaho, Oregon, Washington, and Alaska. So anyway, yeah, lots of funding.
There's a Forest Service has 360 million for trails. They can't figure out how to get out to the counties and the different forests to develop motorized trails. It's like, we'll take it. Oh boy, what a job to apply. It's a big application.
Yeah.
Lots of money out there.
But to your point, Al, like a lot of folks on the ground don't know about these opportunities or have the capacity to pursue them. And so that's how sometimes we kind of have an understanding of the layout of, okay, which communities might need additional help? How can we get them to start applying for those funds? Whether that's sharing staff with another community partner that might have a grant writer or more capacity, right? So that's kind of how the beauty of this model is we can broker those partnerships in a way that just hasn't been happening in the past. If there's no other questions, I think next slide, I think we're nearing the end here. So I think I just wanted to highlight a super basic, math equation here. So, CDH, of course, has funded, the implementation plan pieces and a few other things here and there. But as a funder of WICHC, they've contributed $20,000 in limited funding WICHC for the last 2 years. But I've been able to bring in, 1.1 million at least, and that's not even counting all of the other funds that partners have applied for by citing WHC. So I want to give an example. If you guys saw the news, the United Way of Treasure Valley and the Idaho Coalition for Community Schools received an unprecedented $46 million over the next 5 years for the Idaho Community Schools Initiative. They actually cited their partnership with WHC and like that ability as part of the plan to help facilitate that type of grant award. So that's an example of kind of the ripple effect that's really hard for obviously me to quantify and say, you know, how do I say that we take ownership of that funding? But those are examples. People are using this model and the collaboration to demonstrate that they know how to collaborate, that they are worthy of these funds. And a lot of federal and other types of funders are really keen, like starting to like clue in on, we want to fund regional efforts because we are tired of going community by community, silo by silo. We want something that understands, you know, the various, you know, impacts to a community and can look at things intersectionally. And so that's the beauty of a regional collaborative. And we're starting to see more funding going towards efforts like that, or that are part of a regional collaborative.
So would they have not gotten this money if you hadn't been on?
That's impossible to say. I don't.
Well, I think that's really cool because you don't know the side effects of
Oh, exactly.
this stuff until all of a sudden it's like, here it is. Oh, you already have this. Oh, okay, you can do it. That's awesome.
Next slide, please. And so, yeah, so kind of like looping back to the implementation plan and like the 50,000 that y'all have kind of pledged so far. So just to kind of tie it up in a bow, we conducted 2 workshops with WHC members to refine strategies. Prior to that, we did a landscape analysis and just kind of like, okay, who's doing what, what's going well, what are strategies that could use a little extra juice, that could take it over the edge in terms of impact and benefit to the region or Idaho. And so we came up with this preliminary, very long list. And then the workshop, we refined that list and kind of did some more exploratory conversations. And then after that, we did 19 interviews with WHC members to say, how do you fit in these strategies? What was something maybe you didn't mention in those workshops that you want to mention now? Now that you've processed it, are we missing anything? What are some of the connections? What are the partners we could bring to the table? So that was a really great way to capture that information. And so again, like this has never happened in Idaho's history where we actually have 1, a regional health implementation plan, 2, that it's collaborative, and 3, that it's aligning not only our existing efforts, but it's also combining new efforts. So that's, again, a huge testament to the model and the vision and leadership of, you know, Russ and Nikki and our funders to bring this to fruition. So we've never had something like this that's guiding the work of the collaborative and these partners for the next 3 years. Next slide, please. And so kind of, I know some of the questions you guys had about what would this funding go towards, is 50,000. So we still don't quite know yet because we are now starting to talk about scope and a couple of those nuts and bolts about some of the strategies in the plan. But understandably, some funders have a lot more flexibility than others. The funding would not go to anything outside of the 4-county boundary. We would keep track of all that. Same with Southwest, right? If and when they contribute funds, those funds would stay within those 6 counties as well. But of course, other funders serve the entire region or state. And so we would be able to layer those types of funds to kind of, you know, meet some gaps that might exist based off of variations of funding by district. So think of like Luke's or Al's or Pacific Source, for example, right? And then of course, each funder has their own strengths. And so I think of that as, just by being in a governmental entity as a health district, we've got to go through some hoops to, we have to do certain things, but we can only spend this money on certain things, right? Versus other funders are a lot more flexible, not only in where we spend it, but how we spend it. So we're going to have to do this little bit of a matrix of okay, the 50,000 from CDH will go towards these very specific things because we have the least amount of flexibility towards it versus the other funds would go towards all these other things. So that's kind of why I don't have like a specific ask for you yet, because a lot of those other puzzle pieces have yet to be named. So it'll be a nice little mosaic of funding, but I've got to kind of figure some of those pieces out before I've got a specific ask for you. Questions?
So Alexis, could we use some of this to expand parents as teachers?
Yeah. I mean, unless you wanted to do that, but it would be outside of the WICHC implementation plan, because that's not a particular strategy.
I'll help you spend the money once you figure out where you want to.
Yeah.
Okay.
Okay. Next slide, Dustin. So yeah, in closing, we've got this event on January 11th. It's at St. Luke's, Boise. They've agreed to graciously host us. And yeah, would love to see you there. So please RSVP if you can. And basically, we're going to be talking about the nuts and bolts of the plan. We're going to have a panel of partners talking about why they're really excited about certain strategies or why they're excited to be part of the work or what this means for the region and their organization. So it'll be really interactive and fast moving. And then we're going to have a little bit of networking and some snacks at the end. So that'll be from 3 to 5. We're partnering with Maria to get the word out about some press. So it'll be really exciting. And we got a lot of really great interest and excitement about the CHNA in terms of press coverage. And they were very eager to know, what are we doing about this data? So we're really excited to then be like, this is what we're doing now, and also join us. So I think that's also why I really hope that a lot of you can attend, because y'all have, deep connections to your communities, understand, okay, these are some other partners that I should bring in to this work, introduce to Alexis, that could really help with these initiatives, right? Because again, we want to come back to all of your communities to do this work. So things that I don't know and partners that I don't know either. So it'd be great to have you broker that alignment as well. I think that's it. So
3 to 5
yes, sir.
on a Thursday.
Yes.
I'm wondering, Alexis, maybe you want to send that out again, that invite.
That's what I was gonna ask. I don't remember getting the invitation.
Happy to send it again.
Okay, any more questions? I guess my only statement is, it's so great to see how this has just gotten bigger and bigger and bigger, and you're doing a great job. Ongoing.
You all. Okay.
All right, thank you. Anybody need a break? We'll keep right on going. In your packet, you have something that looks like this that talks about board meetings for next year. That's our next agenda item. Oh, you have an update. What did you change?
Which direction from the transferring it from the calendar to the memo?
So the calendar itself that you have for 2024 is accurate.
Oh, okay. It's true, it's the same.
The dates for August, October, and December were incorrect on that cover letter.
Well, this is great.
But if you look at the 2024 calendar, that's part of the packet,
This is it.
the actual calendar, you'll see the proposed dates. And what we've typically done is just have it on the third Friday. We moved the March meeting just because it was ended up being so close to the February meeting. So it's the third Friday. The first is on a Friday of March. On the 17th, that meeting will be in Cascade because Valley County will host the budget meeting. And for those who are new board members, the budget committee are the chairs of each of the counties where they're designee. And they meet, vote on the budget that's approved by the board at the April meeting. And we rotate that around to each of the counties. So Commissioner Hasbrook will chair that meeting in May. And that's the only meeting that we start at 10 a.m. rather than 8:30 a.m.
Were you having Cascade at the courthouse? Where did we have it?
Ashley Inn, which I don't think it's Ashley Inn anymore, is where we had it.
Yeah, they remodeled that whole facility now, so we may have to look.
We can have it wherever you would like. You're the
Oh, great.
So if you want to have it at your house.
Yeah.
Graciously.
Who's serving brunch?
We have,
Oh, look at me. I can't cook, man. I got to get Mrs. H involved in that.
well, and we've had it at the office in McCall several times.
I think that might be the best option, but they have the room, you know.
It's kind of nice for staff.
Because the Ashley Inn now is called Northbound at Novo, and they've taken away all the big rooms, meeting rooms, and made them into restaurants. So I could go talk to them and see if they can take care of us before we make that decision, but we got a little time.
And then the only other date that I was going to mention specifically is December 20th, because it's pushing right up against the Christmas holiday week. So no problem on staff end, but if it was something that you guys wanted to bump up to the 13th, we could do that. Up to you all.
Anybody have any concerns or conflicts? You know, Russ, in June when the IAB is going to be yet? Do they have a date?
That's our next agenda item.
Oh, is it? I'm sorry.
It's okay.
Okay. And I would really recommend everybody try and make that. Those are really worth time and investment to go. Get to know a lot of the other health districts and their directors and their people. So is this an action item?
It is.
Good. So I need a motion to approve this schedule.
Moved.
Second. Moved and seconded to go with the 2024 schedule as presented. All in favor, please say aye.
Aye.
Okay, motion carries. Now, the next agenda item is not an action item. This is a feedback for the Idaho Associated District Boards of Health. And I'm assuming this is in Idaho Falls. Is that where it is this year?
Yes,
It says here it is, but it doesn't say.
District 7.
So
District 7,
that's what I was going to talk about
okay.
for the 9:55 agenda item. So District 7's director and board, Idaho Falls, would like feedback from all the other boards of health around the state on, they brought up, like, maybe we should just meet in Treasure Valley, for example, because of the convenience or inconvenience to travel to certain parts of the state. So this was their idea as an option that they wanted feedback on. As our board would be interested in. We wouldn't host it. They would organize it. They would do everything that Donna would normally do for us, but it would be in our area, either here or possibly in Canyon County. There are several points of feedback. So that's number one. Would you rather go to Idaho Falls area, or would you rather have District 7 host the meeting in our area? Yes.
Well, one of the things I guess I could say is contribute is that one year we did it up in Lewiston and we got a really cool jet boat ride up in the Snake River and got to see a lot of that country from a boat, which was really kind of fun. I think that's part of, going to these different districts, seeing, their country. But
I have an issue with us trying to be the epicenter for the whole state, the districts. I think, where does that leave Boundary County? Where does that leave District 1?
and they usually fly. When they come down this way, they usually all those guys fly, or most of them do. And I don't know if you can fly from Boundary County to Idaho Falls, can you?
But we hear enough about the great state of
Yeah.
Ada. We need to recognize that there's other areas of the state.
So what feedback would you like me to provide? And again, that was their idea, not ours, as a suggestion. And I think the idea was to increase participation because of the convenience of traveling here to the Treasure Valley.
What about the economics of the travel? I mean, do all the districts reimburse for the travel expenses? And if we're being mindful of taxpayer money, is there a net savings to travel here as opposed to everybody else traveling? Is that
I wouldn't think so.
been evaluated?
I don't know how you would evaluate it, pretty hard, but this is the one time a year we all get to meet, sit down and discuss what we have in common and our problems, our issues. And I think it's really worthwhile to go and be involved. How would you feel about, we would certainly be willing to have it here, but if everybody else wants it and Idaho Falls, then let's go to Idaho Falls. If the other districts, that's my feeling.
In the past, have they noticed the lack of participation when it's not in the valley?
You know,
Is that why they're asking? I mean, what's the issue, I guess?
yeah, I don't think so. I think what I've observed, and I know some of the board members who've been on board for a long time, I guess, it just seems like certain districts, I look at Betty Ann, we've attended a lot of these meetings together. It seems like certain districts have good participation no matter where it is, and other districts have low participation no matter where it is. Would you agree with that?
Yes. And even though our mission is basically the same in all the districts, there are differences. When we go there, we recognize the differences.
Yeah.
What you feeling?
I'm kind of with Betty Ann, where I think that it's nice to get actually in that environment and see. I know it's not as convenient for some.
Right?
Convenience for me, I'd prefer to have it here, but I really don't have a hard opinion one way or the other. I will go to Idaho Falls or Caldwell.
Yeah, Dr. Cole, how do you feel?
I kind of agree. I mean, we do so much centralized here. I wouldn't mind going outstate and, it's such a beautiful state and seeing how people operate in other parts. Maybe even just putting it up to a vote of the other districts. And, if they want us there, I think it would be an honorable thing to do.
I kind of agree. If all the other districts say, no, let's have it in Boise, then let's go for it. But if it doesn't matter to District 7, then we could have it here. But I think it's just really cool to be able to go to another part of the state and see that. Talk to those folks.
All right.
Awesome. So what do you want to do?
I'll just give feedback to the director that's the feeling of this board, but there's more to it. So the other thing was, we've always had it in early June, and there's a discussion of, you want to continue with June? Would you prefer to do it earlier in the spring? Would you prefer to have the meeting in the fall? Just to change the actual month that the Idaho Association of Local Boards of Health meet.
Personally, I like it in June because if we have any resolutions that we want to move forward into IAC, who represents us, we can get it to them by the September deadline. And they can present it to the IAC general membership and then kind of goes from there. But as you guys know, we've been kind of dickering back and forth for a few years now on food fees. And I hope we haven't given that up, but I hope we still kind of keep poking that bear because there could be a change in the legislature, maybe it would go forward, but the trustees are in charge of that one.
Which is very quiet now.
Is it?
The second weekend or the week in June that we've traditionally had it is so busy with graduations, etc. I would be in favor of putting it maybe later in June.
Okay. That has been an issue for attendance
Oh, it has been.
because of family commitments.
So you're thinking like maybe towards the 26th, the week later? Somewhere in that week.
I kind of agree on that. A little later in June would be easier with, we still have kids at home, so schedule wise with school, getting out and graduations, I agree.
Okay, any other comments? Your orders, Mr. Director.
One more.
Oh, okay.
So this year, one we're in, District 1 hosted the meeting and it ended on Saturday. So is there any feedback on the days of the week that you would prefer? Middle of the week, prefer? Historically, it's been Thursday and half day Friday to allow people to travel home before the weekend. This was the first time we had it that I can remember that we had it extended into Saturday.
Well, another conflict with that, and it viewed either way, is IAC.
I was just gonna ask if Crystal, you knew when IAC was in June,
I don't.
because that would be really cool if we could tail off the end of that. Because we're already there, and then the counties can pay that expense.
It's normally that second week.
Yeah, and
Seems like
one
it's
The
thing,
second or third week. By end of the week.
IAC has been in this session just prior to our IAB meeting.
You got Brett Lewiston,
Yeah,
right?
And now we're in Moscow.
Moscow,
Moscow.
but
I don't have it yet.
I guess if it's in Caldwell and we're meeting in Idaho Falls is the only thing. It's not, I don't know where you moved that around. I don't know where you're meeting in.
I don't either. They haven't notified us when that spring conference is.
So I can offer that up because there's a lot of commissioners on the
Yeah.
boards from around the state.
Convenience, yeah.
It would be convenient. So when does IAC typically end? Does it end on Thursday or Wednesday?
Usually Thursday morning,
Okay,
Thursday at noon, usually
Yeah.
something like that.
so
big presentation there.
On their calendar, they don't have it. Sorry.
No, I don't think they have it out yet.
24.
I can reach out to Seth and see if they have an idea or they're, put a plan together and they just haven't posted it yet.
I think that would be worth looking into, and then if we could just dovetail off that, but they're having it, how do you know they're having it in Caldwell?
I don't, I was using that as an example. If they were having it in Caldwell and the IB was in Idaho Falls, it wouldn't be convenient at all. In fact, it would probably cause people not to attend.
Yeah, it'd be really nice to dovetail off that because you get more turnout, I think. You get more commissioners.
I mean, if it was.
It would be ideal in perfect world.
Yeah,
I'm in the location.
Okay.
Time and location are the same.
yeah, right, both. So the Saturday part of it, I guess I didn't know if that impacted attendance. I guess what I observed in Coeur d'Alene was Saturday was.
Sparse.
Sparse, yeah. There were 3 of us there. No, there were more, but it definitely tailed off. And I think that's part of it. People want to be home with their families for the weekend. So, that wasn't proposed. That's just feedback. Those are the third area of feedback. So I got it. We tied in with IAC. If IAC were in that area, obviously if it were Pocatello, that would be convenient to Pocatello region. For Idaho Falls, we would, I guess the Thursday deal, though, if you don't end till noon, that would be probably a conflict if it were going to be a full day Thursday and half day Friday for the commissioners.
Unless Seth can make it to where it's not commissioner specific.
Yeah. Okay. Well, I can talk to him. I think the directors, all the district directors, we've talked about that too. Just like when you were in Moscow, that worked out really well for you to trek on up to Coeur d'Alene and
I
participate.
wonder if we should put this on as an action item in February. You'll know more then, we'll know more then, and then we can kind of, I don't know, I'm just throwing that out there.
Well, yeah, their board will decide. It's just, they just ask for feedback from all of us. So it's just sort of an information item. We won't get to decide.
No.
But I think that I got enough. I think this is helpful to give James, their director, feedback, and we'll likely hear more, maybe by the February meeting. Hopefully by the February meeting, we'll know what their plan is, location, dates, things like that.
And I've always felt like maybe Saturday morning, it was redundant to have those meetings if we could wind it up on Friday.
Right. Yeah. Okay. All right.
Okay, nothing else on that?
Nope.
Let's see what's next. Does anybody need a break before we move on? Everybody's good? Okay, so the next agenda item is the director's report. Include an update on the evaluation of the CDH culture, policies, and procedures.
So I have a couple of items. That's one. So based on the November 28th meeting we had, we entered into a contract with Calix Weaver, and they have been doing staff interviews, and they have about half of those have been completed, and to wrap those up next week. And then they'll be working on a report. I don't see any reason they wouldn't have that finalized for us to distribute to the board ahead of the February meeting. And then if the board prefers, which I would recommend, that we have them come and do a presentation to the board at that time.
And that would be in an executive session, or would that be an open session? It's got to be an executive if you're talking personnel.
That's what, when I talked to Mike Kane about it, that's what he recommended. So when you're talking, if there's anything that is not personnel specific, then you could come out of executive session. If there's any action items, obviously you have to come out of executive session. So that would be the plan, is to do an executive session. I'd invite Mike to be here for any legal questions that might come up, because I expect it could.
And I would recommend we put it towards the end of the meeting. Maybe the last thing on the agenda, Donna.
Okay.
At least an hour.
Okay.
Get it ahead of Dr. Reed.
Yeah.
Like I said, timing, they got on it right away. So that's what we'd hoped, and try to get a lot of this work done before the disruption of holidays when staff are unavailable, and then we'll have some time. I'll get the report to you as soon as we get it, maybe well ahead of the February meeting.
That's a question I could tell.
I just wanted clarification, when the report comes out, will that document be given to the board only, because the under executive session will be distributed in the board packet?
Board
And I'm assuming it'll be attorney-client privilege information.
Any questions about that? And then I just wanted to share staff appreciation for the retention incentives that you approved in August. Laurel mentioned that in the finance report, and to me, it's a really big deal. It's a great thing you guys are doing for our staff. We have the money to do it. We got the federal grant through health and welfare that's going to fund a good portion of that, and it'll be paid out on Friday, January 5th, which is right after the holidays. So thank you so much. And in that regard, I wanted to share, since October 1st, so about 2.5 months, one staff person resigned from CDH, and they moved to Southwest District Health in their exact same position, and they happen to live very close to the office. So it was a lateral transfer, and who can blame them? So I think that's pretty awesome. 2.5 months, one resignation, with obviously good cause. So anyway.
Well, on the other spectrum of that, how many folks did you hire? You know?
Probably 5.
Good.
Yeah.
Good.
So we're filling positions.
Yeah.
Good.
But we're not losing them at the rate we were. Certainly nothing compared to what happened during the COVID era.
Exact count of our employees, Laurel, is what?
We're about 155.
155?
155.
And then the last thing that I had was just wanted to express my appreciation to Donna for all of her awesome work throughout the year, and the time that she took to put these baskets together. Those were handmade.
Thank you.
Well, Everything was bought. She put
Well,
it.
one thing's handmade, your little packet that I put the tea in. The little stickers.
She does an awesome job throughout the year, and this is kind of the conclusion of the 2023 board meetings, and we'll start back up in February. But really, certainly appreciate her and all she does for me and the organization and for the board.
We really know who the boss is.
Yeah.
Runs the show.
She runs the show. Okay, anything else?
That's it.
Do we have anyone in the audience for public comment? Anyone online? Man, we are efficient today.
Yes.
Being no other. Oh, yes. To schedule in, their next meeting will be February 16th here. Put that on your calendar. There being no other business, this meeting is adjourned.
Merry Christmas, Happy New
Merry
Year.
Christmas. Excellent.
Thank you. Merry Christmas, everyone.
Thanks, Dr. Cole.
I would have been there, but I didn't want to get anyone sick.